Good evening, Commissioner Teal. You want to go ahead and check your mic, please?
Yeah, how does this sound?
You sound good, sir. Thank you. Hang on just a moment and I'll start the meeting.
Thank you, Troy.
Hey, Troy. This is Doug. Are we all good to go from your end? Is my mic on? It is.
Yes, sir. Sorry, I was starting the meeting and the recording. You are good to go.
Okay, thank you. If everybody would rise for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Attorney certification of the agenda.
Yes, County Attorney's Office has reviewed the agenda, and all items before the board are appropriate and where necessary have been properly noticed. Thank you.
Thank you. Are there any member disclosures for any item on the agenda? Dr. Fielding?
No disclosures.
Thank you. Commissioner Teal?
No disclosures.
Commissioner Thomas?
I have none, thank you.
And I have none as well. Let us move into the consent agenda. Has everybody had the opportunity to review the meeting, review the meeting minutes? And if so, are there any revisions?
I reviewed them and found no revisions.
Okay. In which case, I would take a motion to approve the minutes from the last meeting.
So moved.
Oh, okay. So let's go to the financial report then. Director Hill is giving me instructions. Also, has everybody had the opportunity to review the 2023 financial report? And if there are no revisions or objections to the financial report, then I would take a motion to approve both the meeting minutes and the financial report.
I will provide a motion to approve the regular meeting minutes from May 11th, 2023, as well as approve the July 2023 financial report.
Do I have a second?
Second.
All in favor, say aye.
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 Opposed? All right, the consent agenda is passed. Director Hill, let's move on to the regular agenda. Director Hill, if you would like to provide your executive director update.
Thank you, Mr. President, and I'm having some issues here because I decided to save paper not print it out, so I can only see part of it on my screen, but I'll try to remember what I put in there.
I have a hard copy if you'd like it.
You are so prepared. Okay, apologies for that, and thank you, Commissioner Thomas. So we've been starting to work on a policy and procedure manual, which will go hand in hand with our strategic plan, which is appearing later in your agenda tonight. We've been doing a lot more outreach into the community. If you go to large community events, you will see us there somewhere. We'll be at the fair coming up. I think on the last weekend, we'll have a table there at the fair. We were at Parker Days and we're at all kinds of other events. I participated in a summit with CDPHE and CalFO, the Association of Local Public Health Officials in the state, to kind of bring all the directors back together. There hadn't been a big in-person meeting of health directors since before the pandemic. So it was a chance for me to meet many of my colleagues who I'd maybe heard on conference calls but never seen in person. It was a good meeting. The state sounds very helpful and open to our discussions and working with us, so we'll see over the years how that plays out. I've been participating on the Region 12 Opioid Council, and we're closing in on getting some RFPs out there to get some more work around opioid epidemic going. We had our first meeting of our child fatality review team. That went well. Some of us participated in the county employee golf tournament. I won't say which team won out of our department, but we'll see. I continue to participate in the homeless initiative meetings each month. We completed our strategic plan, as I mentioned, and it's later in your agenda for review. And just ending today, a bunch of us were at the annual meeting of the National Association of County and City Health Officials in Denver, so we got to hear from lots of federal, state partners and other local health departments, and I think staff were impressed and learned something new that they can bring back to the job and help us do a better work for Douglas County. And future plans are to enact the strategic plan, which you'll hopefully approve tonight. And I'm also going to be doing an in-person retreat with the Metro Denver Partnership for Health. Again, it's a group that has not had a lot of in-person meetings for the last 3 years, so another chance to get to work with local colleagues to work on the health of the Denver metro region. And that's it for me, unless you have questions.
I have questions, but let me defer to my colleagues first.
I have no questions, Mike. I just really appreciate that a lot of places I go, you are there as well, representing the health department. And I think that's a good look for our community to see that we are the Douglas County Board of Health Department, and we're here for the public, and that's why you're there. So thank you, Mike.
So what was the group that was meeting down in Denver?
The National Association of County and City Health Officials.
Oh, okay.
It's affiliated with NACO, the National
Yeah.
Association of Counties, and the League of Mayors,
Cool.
if that's still that organization's name.
So they planned this trip around the Taylor Swift concert, no doubt.
It interfered with our logistics to some degree, yes.
Well, it's interfering with my family logistics, because I got 3 of them going tomorrow, so. The question, so either with your Metro Denver colleagues or the NACO group, as you know, because you've been engaged in it, we're doing an after-action report with respect to COVID and sort of a look at how the county response was, but how the county response was influenced by Tri-County, by CDPHE, and by federal entities, and that is underway, and we're working on it right now. And John Surbeck's back there, who's anticipated not being called on because he didn't wear a tie. And we are beginning to sort of, they are beginning to sort of gather data and gather information in order to sort of do a deeper analysis about what went well, what could go better, and what we need to document for the future, for future public health officials in the county. Is anybody else doing that? Is that any source of discussion in the circles that you're moving in right now, the public health circles you're moving in?
Yeah, that's being done. There are other counties in Colorado doing similar things, and other states and counties are working on it. It wasn't a big topic at this meeting. It would have been more at the preparedness conference, which is the same organization but different focus that happens in the spring. A lot of this was about, kind of gluing health departments back together like Humpty Dumpty after they fell off the wall of pandemic, and everybody was stressed and tired of death threats and recovering their mental health.
From COVID, I presume, and
Yeah, I mean, there was a lot of pressure around the country. Health officers, I think something like 50% of the health officials in the country left their jobs during the pandemic for various reasons, and there's new people coming in who have never run a health department outside of a pandemic, who now have to learn how to do the real world work of public health. So a lot of the focus was on that kind of stuff.
okay. That's helpful. That's I think more than tangentially appropriate response. Is any I don't know if there are any questions from either of the board members online. Apparently, there'd be no. Okay.
Yeah, no questions here.
Well, we are moving
No
forward with.
questions here either.
Thank you, Doctor. Thank you, Commissioner. We are moving forward with our after-action review. I anticipate, I think it's supposed to be done by the end of the year, and I think it'll be illuminative for all of us. We do have written reports. I know, are there any questions based off of the written reports?
I have done, thank you.
Okay.
Can I just want to point out, in case Mr. Bracken is listening, that we did a white paper in response to his questions about some cardiac issues around the COVID vaccine and COVID itself. So that's included in the packet for the public to look at.
Excellent. And you'll send that to him directly?
I will.
Thank you. Let's move on to the action items then. Director Hill, I will turn it over to you to walk us through the action items. And then after each action item, what we'll do is we'll stop and take public comment, and then move on to any vote.
Okay, thank you, Mr. President. So at the last meeting of the Board of Health, you asked me to put an agenda item on here so that the board could discuss changing its meeting frequency to a quarterly basis. So I looked at the calendar and what kind of deadlines there are where I need action from the Board of Health in order to transact our business. And I came up with a March, June, September, December quarterly schedule as the one that would most likely get things covered. So tonight we're approving some financial allocations that probably should have been approved in June, but we didn't meet in June. So having a meeting next year in June will work for that. Having a September meeting kind of puts a meeting before the county's budget process launches, so the Board of Health can weigh in on our budget before it gets to the commissioners. December, there's a few more, state funding allocations that filter in at the end of the year. We can consider them. Then it gives you the meeting to do my evaluation. Then in March, again, there'll be a few more state funding allocations that filter through. And by then we'll have completed and closed the books on this year and can give you an annual report for the year 2023.
Okay. And as folks will recall, we went to we were meeting monthly as the health department was being set up. Then we went to every other month because, frankly, the demands of setting up a meeting weren't, frankly, matched by the actions that we needed to take on a monthly basis. And we also wanted to meet every other month because we were still in the middle of flu season. And we wanted to be available if necessary, or have a meeting set up if necessary to address any issues related to that. We're obviously out of all of that now, and we had talked about going to a quarterly meeting. I believe the statute requires that we meet quarterly. I think that's correct. So this is the minimum amount that we would have to meet, though there's nothing that stops Director Hill or me or the commissioners from calling the Board of Health together in the event that there was some reason to have us all together. And certainly we could meet virtually as well. I think going to quarterly meeting makes a lot of sense myself. I think, you have to plan for these meetings, which takes time away from what other things that you're doing, which, preparing for a Board of Health meeting is great, and it's important, and this board has an important role to play, so long as the meetings are productive and that there are actual things that we need to talk about that couldn't be grouped and release the stress on you and also still have work get done. So I think it's appropriate that we meet quarterly. And what are you proposing that then our next meeting would be September, or what's your how would we move forward from here?
Yes, sir. I'm proposing September just to get us into that new quarterly cycle. And I think there are going to be a few things that I didn't manage to cram together into this meeting that we might have to clean up in September.
Okay. So with that, what I'm going to do is I'm going to open it up for questions or comments from my colleagues. I have an attendee who has raised their hand, but it doesn't tell me who it is.
It's me. It's Linda Fielding.
Oh, Dr. Fielding,
And
please.
I want to say, yes, as long as there is a mechanism for us to meet for things that come up on an emergent basis, I have no problems, no objections to a quarterly schedule.
Thank you.
Do we know what other health departments do, like Arapahoe or Adams?
I don't know what they're doing, but they're also they're 7-month-old health departments where we are an ancient year-and-a-half-old health department. So they probably are still in a more active phase of putting things together. I mean, I think that a lot of health departments around the state, the boards meet quarterly at the minimum frequency, but I didn't do a survey of that. I can't give you numbers.
I appreciate that answer, thank you.
And I think the State Board of Health meets quarterly.
Do they?
Yeah.
Septec does.
Yeah, I think that's standard, but maybe for our next meeting, so let's assume we move to September, whatever our next meeting is, if you could do a poll or ask the State Public Health Association what to do that for you, to just get some idea of at least what some of the metro counties are doing.
I will do that.
Any
Fine with this.
other
So, Mr.
comments?
President,
Yes, Commissioner.
yes, thank you, sir. Hey, I am in favor of going to a quarterly. I know we had spoken about it earlier in the year. I think as the year has gone by, it does look like quarterly is the right way to go for us. I do, but to kind of address Dr. Fielding's question, though, it is covered in our bylaws. The circumstances whereby board members or you yourself, Mr. President, may ask to convene a Board of Health meeting. I wonder, again, I am very much in favor of going to a quarterly, but I wonder if the director would not be interested in sending off that piece from the bylaws to the Board of Health directors, and just to make sure that we have an opportunity to see again what are those circumstances. I want to say off the top of my head, it is 2 board members can call, or it is you, the president of the board, who can call an emergency meeting. And so perhaps if the director would have an interest in just kind of grabbing that for us, maybe shooting that to each board member via email, just to refresh our memories so that we understand the circumstances if we do feel a compelling need to meet prior to our scheduled quarterly meeting.
That's a great idea, and yes, I see Director Hill taking a note to do just that.
Yeah, and I believe I can also call a meeting just to not to be left out of the discussion.
Right.
I'll get it out tomorrow.
Thank you. Let me do this. Let me see if there's any public. If we're done in with board comments. See if there's any public comment from anybody in the room. Troy, is there anybody wanting to comment online?
Thank you, Mr. President. I have no online comment.
Okay. So we have before us review and consider proposal regarding meeting schedule, and the proposal would have us meeting quarterly, with our next meeting being in September and then December and so on. Is there a motion to is there a motion to adopt that meeting schedule?
I will offer a motion that the Douglas County Board of Health meet quarterly, those months being September, December, March, and June.
Is there a second? Oh, thank you, Commissioner. We have a motion, we have a second. All in favor, say aye.
Aye.
Opposed?
Aye.
The motion passes. The next item on the agenda is review and consider staff proposal for added services. Caitlin?
Yeah, well, Caitlin is coming up. A while ago, we had mentioned the possibility of doing a waste tire program, so we think it's time to pull the trigger on that and let Caitlin do her presentation.
Yeah, so that's what I'm proposing today is to take on a waste tire program. And I'll figure out how to use the power pointer. There we go. All right. Ooh. All right. So Waste Tire Program is a program that is allocated to us from CDPHE. It ensures that waste tire generators, haulers, processors, and recyclers comply with the Solid Waste Act and solid waste regulations. We have quite a few generators, haulers, and processors and recyclers in our county. So why do we need a waste tire program? It's one, to verify that waste contractors are licensed and operating in compliance with CDPHE's regulations, to ensure that waste tires are being legally transported and disposed of, to reduce the environmental impact of tires. They can harbor mosquitoes, most importantly, and there's also a pretty large fire and deterioration risk with them. And last but not least, but we would like to promote tire recycling in the form of rubber reuse and tire-derived fuels. We have 130 generators in Douglas County, 5 haulers, 1 processor, and that comes, it doesn't mathematically make sense, but there are 133 total facilities. So some of those facilities are both generators and haulers, or generators and processors, so that's why it mathematically does not make sense. We will inspect about 25% of these facilities per year, which is about 35 inspections, and the estimated inspection time is about 2 hours per facility, which includes travel. The state will allocate $4,700 to us, and that is exactly what I budgeted for wages, travel costs, materials and supplies, and indirect costs. So again, the plan would be to inspect 35 facilities per year, verify licensing and documentation practices of businesses, identify and report any illegal tire dump sites within the county. We would begin inspector training in August and start inspections in September if approved. Any questions?
Caitlin, thank you. I do have a question. Is this work that will be absorbed by current employees, or will you need to add additional staff?
That's a great question. It would be absorbed by current employees. If I remember correctly, I think it worked out to about 65-70 hours of staff time, so it really wouldn't need a full FTE or even an additional FTE at this point.
Thank you. I have no other questions.
So we're taking this program over from the state. Are we going to do more inspections, or inspections not being done? It's a state program, so I assume like they have responsibility for it, but they're probably not doing the number of inspections that would be done. Is that correct?
That's correct.
And so the importance of this, and why that's important, because, you know, every now and again, you know, people look at sort of this public health stuff and they look at waste tires and they roll their eyes, but this is actually like really important. It's important. You touched upon it. One, vector control is super important. We're right now in the middle of West Nile season, and you know, it's mosquitoes, and these tires collect water, the water's still, they get in there, and all of a sudden you have a big mosquito population that is available to start transmitting West Nile, and to the extent that we can avoid that is really, really important. You also touched upon the other issue that I just want to emphasize for everybody. You know, tire fires are no laughing matter. There are tire fires that have been going on for decades, and you get a lightning strike, you get a big tire pile, you get a lightning strike, and it's really, really difficult for first responders to address, for the fire departments to address, and it's frankly not. You know, we're kind of helping them out by not putting them in the position of having to go and fight a big tire fire. So this is one of those areas that is really important, that is a little bit understated. So I think you guys are doing the exact right thing and sort of going after this one early to take it from the state so we can get better protection here in Douglas County.
Thank you.
I think what we just heard is another reason why we're fortunate to have Doug Benevento, who used to be the executive director of the state CDPHE, because you know all these things. You understand all these things, and so you help us and our residents better understand the purpose of why we do what we do here. So thank you, Doug.
Oh, thank you, Commissioner. Are there any other comments? Dr. Fielding or Commissioner Teal, do you have any thoughts on this? I will.
I've got nothing to add that you haven't said. Along with our colleague Commissioner Thomas, I think you guys hit it right on the head. Good questions. This looks totally reasonable to me.
Mm-hmm. The same to me. This is absolutely, with the rain we've been having, I am worried about mosquitoes. So absolutely spot on.
Yeah, and it's cheap too, quite frankly, and they're paying for it, and we'll be able to get better. I mean, this is just such a win all around. So, and it is one of those priority programs that I'm glad to see you guys, you guys are addressing. So let me, with that, let me see if there are any comments from. Oh, we have a commenter in the room. If you'd give your name and the town that you live in, we'd appreciate it.
Good evening, Board of Health. It's Fran Santagata from the Roxborough community. I have to tell you, I am so impressed by Caitlin. I mean, she always looks for more work to help serve her community. And as you succinctly put, this is a really big issue. There's a gigantic dump site right by where Sterling Ranch is now, and I believe part of the deal when the development was approved was to get rid of that dump site. But I know that South Metro was always terrified that we're going to get a lightning strike or a grass fire that was going to ignite that pile, and boy, was that going to be a mess. So I totally appreciate this for the safety of the community. The one question I do have is, so if you find an illegal dump site, what then would you do? Or how would we, as citizens, if we find something, should we call you?
That's a great question, yes. It would be a complaint, so you could either call or email us, or you can also submit complaints online, and we would notify the state and work with them to start remediation.
Awesome.
If we were to find our own, we would also report that to the state and begin remediation.
Do they provide you with funding then?
They do. They have grants available for the property owners as well.
Oh.
So that the responsible party can pay for it. And so we would work together very closely. They would obviously do a lot of training in our spot because we don't know exactly how to mitigate those quite yet. But we would definitely work closely with them to begin remediation.
That's awesome. I didn't know we had a processor here in Douglas County, so I guess the state could help pull all that together.
Yep.
Awesome. Thank you so much.
Yes, thank you.
Are there any other comments? Troy, are there any comments online?
Thank you, Mr. President. Again, no online comments.
Okay, well, it's really important. This is the blocking and tackling of local public health that really does protect people. So I would take a motion to approve the added service of addressing waste tires in the county.
So moved.
Second.
We have a motion, we have a second. All in favor, say aye.
Aye.
Aye. Opposed?
Aye.
The motion passes. Thank you. Director Hill, review and consider Douglas County Health Department acceptance of funding allocation from CDPHE for fiscal year ending 2024.
Yes, sir. Thank you, Mr. President. So again, we've got a long list of allocations that the state makes to us. So just to call our memories back to about a year ago, the Board of Health approved a menu of services for the health department to provide and directed me to make sure any state funding allocated for those services to Tri-County was reallocated to us. So these are those allocations coming forward for the coming fiscal year. These are not, I'm trying to distinguish these from grants because we got off on a tangent at the last meeting. These are not like there's a notice, here's a grant opportunity, come apply for money. That's not what any of these are. These are all programs that we told the state we want to do this program, and they look through their books, and they've got formulae for if this size county does this program, they get this many dollars. And this is for your board to authorize us to accept those dollars for state fiscal 2024. And we'll then go to the commissioners, since they're the fiduciary, for them to hopefully further approve our acceptance of these allocations.
So this is the split that, okay, so Tri-County used to get all of these dollars. This is now the split that is occurring as between Douglas County, Adams County, and Arapahoe County. Right, that's our proportion of the dollars that used to go to Tri-County. Is that what this is?
That's effectively true. That's not necessarily the methodology. It's not like they took the Tri-County money and said, now let's divvy it up. They just look at us as a county of 375,000 people with these demographics. This is what the formula says you get, and the same thing with Adams and Arapahoe.
So they basically reabsorb it and then reallocate it.
Correct.
Okay. And that reabsorption and reallocation was done, you're confident that was done as it should have been done?
I believe so, and I think we actually got a few more dollars in some of these programs than I expected.
Well, thanks for putting that on the record. I'm joking. So so that was the question, really. We just want to make sure that we're getting we just want to make sure that the allocation is treating us fairly, and it sounds like it is.
Yeah, as far as we can tell, and Laura, I don't know if we're pretty happy with the money we're getting for these programs.
Okay.
I mean, we would always take more, but I mean, we feel satisfied that for the work we're being asked to do, we're getting an appropriate amount of money.
Okay. Any?
And happy to answer individual questions. I just didn't feel like trying to read through all those,
right,
how many pages of allocations if I didn't have to.
So it looks like there's 11 different awards for 11 different programs that you have agreed to provide, and it will provide us with $1,895,429.
Correct.
Is that right?
And there are a few other programs whose fiscal period isn't the state fiscal year. So like the WIC grant's fiscal year is in October. So likely at the September meeting, we'd be asking you to approve the coming year's money for that. So it's, in the long run, it's more than the 1.8 million. It's north of 2 million when we figure all these various little bits of money out. And this, just to be open and honest, the money for the waste tire program that you just approved, it was also in there for approval, assuming that you might approve it.
I don't have any other questions. Thank you.
Are there any other questions? Hearing no questions? Hearing no questions, I'll go to public comment. Are there any comments in the room? Troy, are there any comments online?
No online comment.
Thank you. With that, I would entertain a motion to accept funding allocations from CDPHE for state fiscal year ending June 30, 2024.
So moved.
Second.
Okay, we have a motion, we have a second. All in favor, say aye.
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 Aye. Opposed? Okay, the motion passes. The budget is adopted. Director Hill, review and consider proposed Douglas County Health Department strategic plan.
Yes, sir, thank you. So we went through a multi-month strategic planning process. We had a fairly large group of people, which included 2 of your board members, 1 of your board alternate members who's in the audience, several of our staff from other county departments, IT, communications were involved, human services. So a nice group of not just ourselves, but others who are involved with us to help with the strategic plan. We hired a consultant to guide the process just so that meetings are facilitated and notes are taken in an orderly fashion. I think they did a good job. So what we came up with is what's in your packet. It may not look like we're out there reaching for the moon with this strategic plan, but it's a case of us building a firmer foundation for the health department to do its work into the future. It does address the major issues that were in the community health assessment and the public health improvement plan, aiming us toward disease prevention and mental health issues and substance abuse issues. Even though it doesn't seem like it's taking on new shiny object projects, it's building the structure that we need to be successful in working on those programs. And I would invite Dr. Fielding, if she's so inclined, to comment on the process, since she was involved representing you.
Okay, I certainly will. I strongly support this effort because we need something which gives us a firm direction for future growth. And this was a multidisciplinary look at what the health board is doing and what it should do, with the ability to look at the results, to measure results in this, and to plan for the future, to see what works, what doesn't work. This is not the time to go overly ambitious to the moon, but to get the basics right so we have a strong foundation for growth. And I think that Mr. Hill's group here did a fabulous job, and this has my strong support.
Thank you. Anybody else in the room that was involved in the process want to chime in on this?
Let's do board stuff. No, okay, that's fine, that's fine, yeah.
That was still part of my presentation.
No, that's good, that's good.
Looking for allies to help support the presentation.
So Catherine's coming.
Catherine's going to come up and say something.
Give your name and the town you live in.
I was chewing on a mint. I'm Catherine Willie. I'm an alternate on the Board of Health, and I got to participate in this public health improvement plan. And one of my intentions of going in was just to, since I was part of the first one, through our community health assessment and our community health needs assessment, we really took the time and the effort to listen to the citizens. And I wanted to make sure that that voice was still carried over into this. And I have to say, I asked for transparency amongst the group, and they know what's going on. They know our identity, they know our truth, they know our needs, they know our wants. And I'm really grateful for this public health improvement plan. You guys are right, it's not this big shiny thing, but it's a great starting point. Gives us an idea of how we want to move forward. The staff has an idea of what are appropriate expectations that are attainable, and we have a way to measure our services to the community and our staff as well.
Give me the 10,000-foot view, describe this to me. What's the takeaway as Commissioner Thomas or Commissioner Teal are being asked by constituents, they're at meetings that, okay, it's this Board of Health, what does it do? What's the strategic plan I've been hearing about? What should they say?
That's a really good question. I think I would say we have heard the community, and we've heard a lot of different voices. And the voices of the community were from what we've done in the past, what Tri-County has done, and what we hope to do in the future. We've heard the community voices. We are implementing their voices. And we also have our experts who know the field, who know what's going on, who have the big picture view, but they're also the boots on the ground of what can be done, what's attainable. And then there's also this funding option. We talked about funding. I learned a lot about that balance of funding and what our needs are, and where there may not have been as much funding as I personally wanted from the state that I had saw. The staff is going to still fulfill that because it's a community need. And that was the part that I wasn't surprised, but super grateful. Does that make sense? We're doing this, and this was the right decision for our community.
One of the bases for starting the health department was that we're different. Douglas County is different than Arapahoe County, different than Adams County. They're different from each other, and that we wanted to sort of chart our own. I thought it was one of the brilliant aspects of why the commissioners chose to do this. We wanted to chart our own course so that we could have public health services that were directly addressing the needs of Douglas County residents and not having to jockey with the other two counties to have that done. Does this strategic plan do that?
So I don't know if I can share the story of Commissioner Thomas when I was interviewing to be on the public health improvement plan, but one of the stories I do like to share is I was hesitant for us to be our own Board of Health, to have our own health department. So that is now documented for everyone to hear. And she goes, well, I hope to prove you wrong. And I go, I hope you do prove me wrong. And going through all of this process and being alongside everyone completely every step of the way, we are different. Douglas County is different. We do have different needs. And she proved me wrong.
You're among a long list of people Commissioner Thomas has proven wrong, so.
But I'm just proud to say that I'm just proud to say that I have seen it with my own eyes, and I have been blessed with that opportunity to work alongside this process. So thank you for believing in me, and thank you for allowing me to be a part of this, because I was in the middle. I wasn't sure where we were at, and Douglas County is going to do great things, and we are different, and we do have different needs, and this staff is absolutely going to serve those needs. And that's the part I think I would like to have you express to the community is we're all going to be taken care of with the absolute best, and our future is very, very bright.
Thank you.
Yeah.
So Catherine, let me just add that because you were willing to give us a try and be involved in the process, I did ask you to be my alternate, which I think is a huge honor for you, so thank you.
Thank you.
Thank you.
If I might add one other thing to this, we are different. We have set goals, and we have accountability and transparency, which is something that is a pride of Douglas County and is strongly throughout this plan.
Well, having had supporters with my statement, I'll close there and let you have your board discussion.
One last question I have for you. This plan's 2023 through 2026. You make a good point that we're a relatively new health department. I anticipate that that there will be evolution in the health department and the things that it wants to address. I assume this is over those 3 years still going to be a living document that can be reviewed and changed as necessary.
Yes, sir. So we'll be building a performance management system which will monitor our performance against this strategic plan. And we would look at annually looking at our performance and looking at the plan and deciding whether we've aimed too low and we need to raise the bar, or we aim too high and we need to lower the bar. So I would think we do an annual assessment on that.
Okay. Any?
Mike, I'm just going to add that I think that this is a testament to the reason why we hired you. Because I see on here where it says weaknesses is that we have a flat organization. I think that's a strength because it is what we asked you to do. We asked you to create a department that would be ready to respond to the public and not get caught in a huge bureaucracy. And you've done that. You've been such an excellent leader. I think you're such a good fit for us. So I'd like to thank you for putting this together.
Thank you. And just to comment on why that's in there as a weakness is from a workforce development standpoint, there's not career ladders in our department. So if someone comes into a flat organization, they come in on the ground floor and they leave on the ground floor. So that's why it was listed as a bit of a weakness. We can't attract people with a big career ladder.
I see. Thank you.
Are there any other questions or comments from the board?
Well, I'll just jump in and I'll just say that I think. Sorry about that. I think this is great. This is really not the final task, probably, of implementing this department, but it is certainly one of our implementation tasks because we always had it from the time we founded the Board of Health to when we did bring Mike on. This idea that, and then we've got to have a strategic plan. So this is really kind of that final. Mike's probably going to chide me and say it's not the final task, but that's kind of one of the last tasks to actually standing the department up and getting it operating on its own. So this is great to see. It sounds like we had good stakeholder involvement, Mike. So I'm glad to see it. It charts the course for the next 3 years.
Thank you, Commissioner. And I did try to brag at every turn about the active participation. I mean, we not only had a broad group, but they all participated vocally in the process.
Right. Well, Is there any other public comment? Your name and town you live in, please.
Hello again, Fran Santaga. I have to commend you on the efforts here. I really wanted to jump on Catherine's comments about the transparency and the obvious effort to meet the needs of those initial efforts, that the concerns of the citizens were going to be met by this board. And I saw a fearlessness in the SWOT analysis that I thought was outstanding. You guys were not afraid to hit the points that are often controversial about standing up a public health department and some of the political issues that cropped up during COVID and what have you that could stand in the way of success. And the only way you can deal with that is to deal with it head on. And you're doing that. And so thank you so much for these efforts. And I do think, that the plan that you came up with really lays a strong foundation, and it gives you the flexibility to move in any direction that you need if some crisis arises based on the way you've organized this. So thank you all for the efforts that you put in.
Thank you. Any other comment from the public in the room? No? Troy, do we have any comments online?
And no online comments, sir.
Excellent. So I would seek a motion to adopt the Douglas County Health Department Strategic Plan as drafted.
I have a motion to adopt the strategic plan as drafted and presented by the executive director.
Do I have a second?
I'll second this.
Thank you, Dr. Fielding. Thank you, Commissioner.
Dr. Fielding, yes.
All in favor of adopting the strategic plan, say aye.
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 Aye. Opposed? Excellent. The plan is adopted. The last item on our agenda is review and consider proposed Board of Health Finance Committee charter and appoint 2 committee members.
Yes, so last meeting, we created a finance committee, but it lacked any structure behind it. And just to repeat, the impetus for this is the CDPHE's finance people are adamant that we need a finance committee. I have not been able to find evidence that any Board of Health in Colorado has a finance committee, but they demand that we have one. So just since they sent me $1.8 million, I figured I'll acquiesce and create a finance committee. So I also tried to find a charter to describe so everybody would understand what this committee was meant for, and future generations could know what it's for if they're appointing new members. But basically, so we're going to a quarterly meeting schedule. If something comes up that needs to be approved by the commissioners, which means it needs to be having Board of Health approval first, I would call this committee together to go over whatever it is, vote, and then we could, if they approve, pass it on to the commissioners. The full board at its next meeting can always reject anything that's approved by this finance committee, just like you can reject things that I've approved in the meanwhile. And then we'll just have to figure out how to unwind whatever it was. But this A checks the box for CDPHE and gives us a little more financial nimbleness as we move to a quarterly meeting schedule.
Good explanation. Any?
I think he just described a bureaucracy.
I was trying not to use that word tonight, Commissioner.
I did.
Any questions from any of the board members?
I have none.
I have none.
None.
Hearing no questions? Oh, go ahead, Commissioner, I'm sorry.
Question for the public health director. Did I miss it? Do you have a recommendation on who should be on the finance committee, the composition?
Yes, sir. So the other part of that, the ask in the agenda is that your board appoint 2 members to this committee and appoint one of those members to be the chair. The reason for 2 is that if it's 3, then it's a quorum of the board and it's a Board of Health meeting. So it's kind of a slippery slope here.
Can alternates serve on that?
Well, since I wrote its bylaws, I suppose I could amend them to say that if that's the board's pleasure.
Okay. what I would, and perhaps our board members want to do it, I just want to have the biggest pool as possible to consider. I don't think we need to decide that today, or do we?
Well, I would like to leave the meeting with a committee in hand. If your board can always, and I've written in these rules that you can remove and replace people pretty much at your will. So at the next meeting, if whoever you appoint tonight decides they'd rather not, then you could appoint somebody else, and you can direct me to amend these bylaws or charter in such a way as to allow the alternates to be appointed.
So, I think, well, we're sort of in the awkward spot now of sort of asking people to raise their hands. Not all the board is here. If we can do alternates, then, obviously, we would need to ask them. Ideally, you ask somebody before you put them on something like this, though it's not required. I guess can we wait before we do this?
Well, okay. The only issue gets back to our dear friends in Cherry Creek who are adamant that we have this, and creating one at the last meeting without appointing members did not satisfy their urge for us to have this committee. So, could we amend, Jeff, can we amend this charter on the fly to allow alternates?
You can. It hasn't been adopted yet. You can totally do that.
Okay, so let's do this. Let me make a suggestion, and then people can shoot it down or adopt it. First, let's amend the charter to include eligible members of the Finance Committee to be board alternates. So that's one. Two, in order to satisfy the needs of the state, why don't we name put some interim names down, and then we can sort of figure out how we want to move forward from there. Is that? And I guess as what I would so we're gonna amend. Let's talk about the interim names. First, is there anybody on the board that is seeking to serve on the Finance Committee?
Mr. President, if it would be helpful, I'd be happy to do that.
I was going to suggest I would be happy to do just on the interim basis, so you have folks to name. Unless there's an alternate out there that would like to sit on the Finance Committee, and we would be happy to appoint her to that position. We have a volunteer for one of the board alternates. Thank you, Catherine, for agreeing to serve. Commissioner, I'm happy to have you if you want to do it. I'm happy to have Catherine and I serve on that interim basis, unless you want to do. What I don't want to do, and I know your duties are pretty substantial, so I don't want to add something else onto it.
That is fine.
Okay, so Catherine and I will be the interim Finance Committee members. You can report that back to the state with the asterisk that it's interim, and then maybe it'll be permanent for one of us, maybe for both of us, but let's figure out where we want to go from there. But what I'd really like to do with this, and I think this is a good opportunity to keep board alternates engaged in what's going on with the Board of Health. I think, as board members, we get the emails, we're engaged. We know that, now quarterly, we're going to be, live, and we need to read stuff, and we need to be prepared. I think for a board alternate, it gets a little bit, they're the understudy, so it gets a little bit more, keeping them engaged, I think, is a little bit more difficult. Ideally, what we're going to come back with, I'd like to have a couple of board alternates serve on that Finance Committee as a way to keep them engaged and also get them prepared to perhaps serve as future board members full-time. So that's my plan.
Sure. As long as I get the state satisfied, I'm happy to accommodate your wishes too.
Thank you. Oh, and I think you'd be happy to accommodate them anyway. So if with those, so what I'm going to seek, we're going to go to public comment. At the end of public comment, I will seek a motion to amend the bylaws to include board alternates as eligible participants on the Finance Committee. and to approve on an interim basis that the appointment of me and Catherine as Finance Committee members. So with that said, let's open up to public comment. Anybody in the room that would like to comment? Great. Troy, is there anybody online that would like to comment?
Mr. President, I have no online comment.
Okay. So, if I could have a motion, again, to amend the bylaws, to adopt the bylaws as amended by allowing board alternates to serve on the Finance Committee, and then to have the interim Finance Committee members be Catherine Willie and myself.
So moved.
Do I have a
So
second?
moved.
Oh, do I have a
Second.
And I have a second. All in favor, say aye.
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 Opposed? Excellent. So we are done with the action items for the day. And now we have citizen comments. And if there's an issue that we have not discussed that any citizen would like to bring up, you have 3 minutes. And we will, if there are any questions, we'll answer them after you're done with your comments. You would name and town you live in, please.
Fran Santigata and Roxborough again.
Thank
I
you.
really wanted to commend Dr. Dan for the paper he did on the cardiac complications. It was, I think, heart-wrenching for all of us to hear Mr. Mayer talk about his relative having succumbed to some very serious side effects that they were thinking might have been connected to the COVID-19 vaccine. And so it's so great to have somebody bring the facts together in a very objective way and present it to the Board of Health, because it's so easy for people to go off on tangents and not look at the bigger picture. And so thank you so much. The information was fabulous.
Thank you for that. Is there any other comments? Any comments online?
I have no online comment.
Excellent. Okay. Well, with that, I would accept a motion to adjourn.
I have a motion that we adjourn the Board of Health meeting.
Hearing a
I'll
motion.
second.
Hearing a motion in a second. All in favor, say aye.
Aye.
Opposed?
Aye.
We are adjourned. Thank you very much.